Everybody, let's talk about your money moves this morning. Healthcare, one of the biggest expenses many people will face in retirement, often also one of the easiest costs to underestimate. There's a new Fidelity study out that shows somebody retiring this year could spend $185,000 a year or more, or not per year, I'm sorry, during retirement, $185,000 on healthcare alone during retirement. So we got to start thinking about it. The question is, how do we start thinking about some of this long-term planning when it comes to healthcare and retirement? So let's talk about it with Julie Bates, Certified Financial Planner, Vice President, Delta Community Credit Union. Julie, it's always great having you on the show. Good morning.
Thanks for having me this morning, Dan.
All right, 185,000, a big number, gets your attention. What should we take away from reports like that?
Think about healthcare not just about medical bills, but beyond that, as a threat to your retirement income and the most overlooked component of a retirement plan. That $185,000 number that Fidelity mentions is just for one person. So a couple needs to be prepared to pay twice that amount. And later in life, when we're most vulnerable, we could see custodial care costs with long-term care of more than $100,000 a year on top of the $185,000 for medical bills alone.
Okay, let's talk about Medicare because open enrollment begins in just a couple months in October. What are some common mistakes you see retirees make when it comes to choosing or renewing their Medicare coverage?
The first mistake I see people make is believing the lowest premium plan is the lowest overall cost. The second mistake is that the current year's plan continues to be the best option for the next year. We all experience a lot of changes. Our doctors change, our health changes, our prescriptions change, and Medicare plans themselves change. So think of open enrollment as an opportunity for an annual financial checkup to make sure that all of those changes that you experience during the year still align with your healthcare decisions.
And Julie, some retirees actually pay more for Medicare than others. Do we know why that is?
Yes, the average retiree pays the standard Medicare premium, which is $202.90 per month. Some people pay more because they have higher income. Medicare is what's called means tested, so individuals with higher income are going to pay a surcharge. Also, Medicare looks back 2 years into a person's compensation. So in 2026, they're reviewing your IRS tax return from 2024 to determine your Medicare premium amount.
What if someone's income has dropped because they've retired?
And that's very common. In fact, most retirees see a significant drop in their income.
Yeah.
So if someone's income reduces, whether that's because they retired, maybe they had a loss of a spouse, they got divorced, their Medicare premium should decline. But again, remember, Medicare is going to look back 2 years. So what they can do is they can request a form SSA 44. That form is like a notification to Medicare that your income has declined significantly, and they will recalculate your premium based on today's income.
Tell me again when we should be filling that out, because that's the first time I've heard of this form.
Yes, it's called SSA 44. It's a very underutilized resource that most retirees are unaware of. It's your ability to communicate to Medicare that you've had a material reduction in your income. So take an example. Someone had full-time earnings of $180,000, and in retirement, their income is $70,000. So if they fill out this form, they're able to recast their compensation to their current income and significantly reduce their Medicare premiums.
You've given us a lot to think about today, Julie. When should I be sitting down with a financial planner to discuss what health care and long-term care looks like? Is it 5 years before retirement, 10, more than that?
The best time to discuss healthcare planning is when you're healthy enough to still have options. That could be 10 to 15 years before retirement. It allows you to consider not only your Medicare options, but being able to qualify for long-term care strategies and to determine whether retiring at 65 or earlier is even realistic.
All right. What other advice do you have for folks today? Anything I'm missing?
So think about retirement planning beyond protecting your wealth. You want to protect your health, preserve your independence and your quality of life. thinking about medical beyond your standard doctor's visits, your dental, your vision, long-term care, and hearing coverage. Many people discount all of those things. So really protecting your entire financial picture includes protecting your health, and so many times that's overlooked.
HSAs, great way to protect your health and your wealth too, right?
Yes,
Triple
sir.
tax advantage. All right, Julie, great having you on the show this morning, as
Good to
always.
see you.
Thank you. For more stories like this and to catch this full interview here shortly, just go to 11alive.com/moneymoves, where we have links to other segments with Delta Community Credit Union. We always appreciate them coming on the show, sharing their expertise.